known as the Wilson's disease. Now, what do this disease mean? Very small discussion, I want to only mention that it is a disease of copper metabolism. The problem is in the excretion of copper from the body. So copper deposits in different organ of the body. It may be brain, liver, eye, etc., and they cause different sorts of problems. And it is a genetic disorder. It is an autosomal recessive, and the problem is in ATP7B in this gene. So in short, it's a genetic disorder. It's posing the problems in the copper deposit. So now we should go forward and learn about the management of this problem, as our focus will be on management. And what is the main goal of our management? What we want to achieve from the management? In examination we have to write this aim or goal. So in short, we will remove excess copper from the body, and then we will also prevent its reaccumulation. Once we have removed it, and we cannot give access to copper again, and ultimately this will help to stop the organ damage like liver and brain. And if we treat early by family screening, we have to find out the patients who are suffering from the problems, and even before symptoms appear, and the prognosis is good. So we will have to treat in such a way. Now, what is the treatment? What is the medical management of this disease? Now, treatment, let's start with the treatment. There's medical management, that is pharmacological or medical management. What are the management? So the drug of choice is penicillamine. So these are, at first we are using these drugs, these are chelating agents. They will remove, specifically this drug will remove copper by binding and through urine, and it is also known as we call it capriuresis. So it increases urinary copper excretion. It's a very small dose needed, or I think 1 to 4 microgram per day, this amount needed. And dose can be reduced. You can reduce the dose. Can be reduced. When you reduce? When the disease is in control. You have to monitor the disease or copper level in the body, and then you can say disease in the control, and it should be treated lifelong treatment. Okay. And even in pregnancy, you cannot stop this medicine when in pregnancy state, those who are suffering from it. Okay, because if you stop it, another important thing, if you stop abruptly or suddenly, then what happens? It may leads to acute liver failure. So guys, again keep in mind, we usually use these chelating agents. The drug of choice is penicillamine. It will cause capriuresis. You will have to continue this drug lifelong, even if it is in pregnancy. You can reduce the dose, but if you stop it then abruptly, then it may cause acute liver failure. Okay, acute liver failure. Now let's go to some important things with this drug you have to keep in mind. Penicillamine, what happens sometimes, the side effect or toxic effect you should keep in mind when you are managing those things about some effects of drug. Toxic effects of penicillamine, what are that? Most importantly, we have seen the skin rash. Okay, in kidney, as the drug is excreted through kidney, it may causes protein losing nephropathy. You may have bone marrow suppression or lupus like syndrome. Okay, very important toxic effects. If these toxic effects occur, then we have to keep in mind about two other alternatives. So what are the alternatives? Most important alternatives you have to keep in the mind. What are the alternatives? Number one alternative, the name is trientine. Okay, second one is the zinc salts. Okay, you can use zinc salts 50 milligram 8 hourly or 3 times daily. Trientine, it's called 1.2 to 2.4 per day. Okay, so this drug have the fewer side effects. So penicillamine is the drug of choice, but when there is toxic effect, then you have to shift to those drugs that have fewer side effects and also effective. Okay, and now next we will go for another important thing, that we have to monitor. We cannot, as I have already mentioned, we cannot stop this drug. We will have to do family screening and start treatment in asymptomatic family member. So in asymptomatic family members we have to keep in mind. Okay, the next treatment status that come after pharmacological treatment, that is the liver transplantation. So when you will do, there is liver failure. Okay, advanced cirrhosis, last stage of cirrhosis, that is causing the liver failure. So liver transplantation is the last resort. So in the end, I want to mention that you keep in mind the drugs, and finally penicillamine. If it is not possible, trientine, not possible, zinc salts, and in the final stage when there is liver problem, liver transplantation. So that's all from today. Thank you very much for watching. Keep watching my channel, and I will upload daily medicine related videos. Thank you very much.